¿cómo estás?
The Texas Medical Association believes any health system reform must put patients' needs first. So that's the message TMA sent to members of Congress when they took up the issue. We also hit the road and made house calls across the state. We wanted to hear firsthand what patients want and do not want in health system reform. TMA traveled from the Panhandle to the border, making 18 house call stops. We listened to more than 3,300 patients and doctors who shared their opinions, hopes, and fears. Though Texas is widely diverse, patients' opinions on health system reform were not. Everywhere, they agreed on three themes. Patients called for national medical liability reform, especially since Texas reforms have worked. And many said the government should keep their hands off health care. The most common theme, that health insurance needs reform, is summed up by TMA President Dr. William Fleming and echoed by Texas patients.
No matter which side of the debate you're on, we agree on one thing. Big insurance companies need big changes, and we need to keep insurance companies out of the decision-making process between you and your doctor.
I think we really have a health care insurance crisis in this country and not as much a health care crisis in this country.
I'd like to see a show of hands of everybody who's read their insurance policy that totally understands it that they have today.
A third of my salary was going not towards health care, but it was going towards health coverage.
What I want out of health care reform is to see insurance companies no longer deny health coverage and refuse coverage for pre-existing conditions or charge you more because of your occupation or health condition or gender.
The problem that I have is what this young man talked about when the insurance companies say you have a pre-existing condition and we're not going to insure you.
I also would like to see insurance companies less involved in doctor decisions. It is not right.
At most every house call, patients and doctors agreed that Congress should pass national medical liability reforms, especially since Texas patients have benefited from the 2003 reforms.
One thing that I would like to see is tort reform.
The country could be very well served by just doing a cut and paste of what Texas accomplished with tort reform as far as attracting a lot of excellent doctors to the state. So it does work in Texas. Let's try to see that nationally.
Take a deep breath.
Throughout the health care debate, TMA has asked Congress to fix what's wrong and keep what's good in America's health system. House call participants agree, fearing the government won't make the right decisions about their health care.
From earlier, we heard from the TMA, what we need to do is we need to keep what's good, change what's bad.
I don't want government taking over my son's health care.
But I certainly value the quality of care we get and the fact that I'm able to get it.
I felt I had the best care possible. I would not want a government official making that decision for me.
I hope that the decisions I make will not be dictated by an insurance company and will not be dictated by a bureaucracy. I hope that any decision I make will be between me and my patient.
I'd like to have the same coverage that the members of Congress have.
I think that it'd be appropriate that everyone, including the president, have to use the same health care system that all the rest of us does.
One thing crystal clear from all 16 TMA house calls is that patients and doctors want a health care system that puts the patient first. And they want government to keep all the things that are good in our current health care system and fix the things that are wrong.